healthcare systems. Right. We move on to the first speaker for the opposition, and that's going to be Dr. Kamalika Mukherjee. So may I invite Dr. Kamalika Mukherjee to please come up and give her arguments.
Mr. Chairman, sir, members of the House, ladies and gentlemen. Following Dr. Sinha's excellent presentation, very erudite, I'm going to focus on a couple of key areas. Firstly, let's focus on the word health care system. Healthcare system is not about individual doctors' interaction, clinical interactions with patients. Healthcare system is a conglomeration of doctors, other healthcare professionals and institutions that get together for the betterment of society and meeting the health needs of a population. How can we, as doctors, where our trade was crafted as healers in Greek temples and Ayurvedic practice as in India, how can we ever divorce ourselves from our moral conscience and construct to society? How can we do that? I'm going to argue that doctors absolutely have a hand in running healthcare systems. And this is why. They should and must be involved in running healthcare systems, and they need to be key architects of strategic planning and delivery of these systems. Why do I say this? Doctors are very unique. We have a very long process of education. We study not just clinical subjects, we study life experience. Every bit of our education brings us in contact with human beings and the human psyche. I'm a psychiatrist by profession, but I didn't craft my trade when I started as a psychiatrist. I crafted my trade in medical school, in these biochemistry labs. I was watching the teachers, I was watching my interactions with my peers. Doctors bring their very, very specialist and unique clinical and professional knowledge, which is most likely to be heard and acted upon, much more than any politicians, any commissioners, any financiers. Doctors have very key messaging and strong communication skills. We are the people, doctors, who give the bad news. When the shit, pardon my French, hits the fan, it's the doctors who pushed in front of the patient party to give them and damage limit the bad news. We've got a lot of this, which is a key leadership skill, and we can bring this to our planning and delivery of healthcare systems. Doctors are in contact with all strata of society. We've got lots of eminent doctors in this audience and on the panel. We're reality-based, and who knows it better? We're approachable, and by and large, we are non-hierarchical. Our leadership style lends itself best to being that architect of that healthcare system that needs to meet the needs of society. We've talked about healthcare systems being a conglomerate. Doctors, other healthcare professionals, and non-medical people. We've got soft power. You don't know that you've got it, but you've got it. You've got the influence over people to make you listen to what you've got to say. And believe you me, you've got a lot of knowledge and skill, and you've just got to communicate that, and you can make change happen. We spend a very long time in clinical care, very specialist, but we also have a lot of core general skills. This is very essential in healthcare management. We need that flexible style of communication, that messaging, that being able to give that bad news in a nice way. That's absolutely essential when you're delivering and developing healthcare systems. Now, we have a perception that doctors are not trusted by the public. That's rubbish, ladies and gentlemen. In the wake of the global pandemic, in 2021, there was a very interesting survey carried out by Ipsos Mori. It was worldwide, 20,000 people, adults, across 28 countries, including our very own India and the UK where I work. It was called the Global Trustworthiness Survey. I wonder who comes up with these names. But it still maintains that doctors are still the most trustworthy profession us are scientists and then teachers. Bottom of the pile, politicians. Above them, the people that you, the doctors, are trusting to run your healthcare systems. Now you might say, why would doctors, oh, we haven't got the skills. We might struggle as, being these managers. How are we going to balance the clinical world and we're going to have this identity crisis. We're no longer going to be the doctor, we're going to be the manager. We might provide a restricted, very scientific, profession-specific view, not a global view. We don't have the management competencies. We didn't go to business school. We don't have training in finances. I can't read a finance balance sheet. I tell you, ladies and gentlemen, I've converted to the dark side. I'm a psychiatrist by profession, but I haven't put in my bio. I'm a clinical director for healthcare services in the United Kingdom. And I have learned in months to read an Excel spreadsheet and do balance sheets. It's no big rocket science. You can all do it. So we can remedy all of these skills. And this is the reason why non-doctors are not the best answer to healthcare leadership. Healthcare management is very unique. It requires a mix of values first. If you're not a good human being, you're not going to be a good doctor. It requires clinical perspectives, understanding of patient and your team's experience. Healthcare is a unique industry. Every end point is about human being to human being interaction. Tell me one profession in the world, other than our paramedical professions, our supporters, our teams, where this happens. So, I conclude that it is a paradox that many doctors see clinical care as divorced from the delivery of the healthcare system and leave the management side of things in the hands of generally incompetent, non-medical managers. I rest my case. Thank you.